Hello and welcome to our webinar here on benefit access. Thank you so much, everyone, spending time with us today. I know a lot of the folks in the chat and joining us today are navigators and case managers, and they work really hard to make sure everyone can access the public benefits in their community. And so, thank you for spending some time with us. My name is Laura Glab. I'm the CEO at MyFriendBen, and I'm honored, more than honored, to spend my time today with Joe Diamond, the Executive Director at MASSCAP. Joe, it's so great to have you.
Well, thank you, Laura, and I'm equally honored to be here. Happy to talk with you about my friend Ben, its current and future.
Amazing. And Joe, for those who maybe don't know, I mean, it's a Massachusetts webinar, so probably a lot of folks do know you, but can you tell us a little bit about MassCap, your role at MassCap, and kind of what your mission and the work that you all do is?
More than happy to. And this is a little bit like the elevator speech that I give, but let's say this is a really tall building, so we'll have a longer elevator speech. MassCap is the association of the 23 federally mandated anti-poverty agencies in Massachusetts, known as community action agencies. They are joined by about 1,000 other community action agencies across the country. These agencies were created along with a score of other programs like Head Start and legal services and other programs in the 1960s as part of the Great Society programs, actually in 1964. In our case, to address poverty. And it is no coincidence that we were created around at the same time that the Civil Rights Acts were passed in that year and then a year later. Because our purpose is to address poverty, address its causes, address its effects, but to promote opportunity and equity in all of our work. And that work includes, quite appropriately, up to about 100 different services that our agencies are able to help the 600,000 people that we serve access across the state in an effort to help people become economically stable and mobile. We also advocate with allies, with elected and appointed officials at the state level, at federal level, for programs and policies that are important to the people that we serve to address a series of things we'll talk about a little later, I'm sure, structural issues, as well as improving programs and practices that help people gain access to these programs.
Amazing. And so when you say something like anti-poverty and 100 different kind of initiatives, programs that you all are running, tell me a little bit about where does benefits access and public benefits fall in that as your, mental model of anti-poverty for your community?
The programs that we administer include programs like fuel assistance, weatherization, early education and care, including Head Start, programs that help people who are seeking affordable housing, helping people who are needing rental assistance, people who may need shelter. We also have workforce development programs, and we provide programs for people so that they can access really critical tax credits like the Earned Income Tax Credit and Child Family Tax Credit and other tax credits across the state, and a score of other programs. And the way that we approach this, and this is sort of part and parcel of my friend Ben and why it's so important, that we have no wrong door in Massachusetts, or that is in our agencies. We think about our programs as sort of part of an integrated service model, so that if somebody comes to an agency, they are not only assessed when during intake for what they come to us for, which could be fuel assistance or tax credit services. They're assessed for everything else that they could qualify for. And so that integrated no wrong door approach is really important to us. And it's something that we have been doing for the almost 60 years or over 60 years. But we became much more intentional about it, say in the last 20, so that our members are in a position now to really be able to help people in as streamlined a way as possible. That's not to say that we perfected it, because we haven't. My friend Ben is so critical because it's sort of symbolic in some sense of the trends and the themes and the activities, the initiatives that have taken place in that area of activity, that area of making services more accessible to people. There have been conversations in Massachusetts, and people have taken steps to improve categorical eligibility, to make sure that if you qualify for one program, you qualify for another, to develop perhaps a common app, a common application for programs, to make applications as universal as possible. And then we also consider integrated services or blended services. Part of that. My friend Ben is so critical because we've talked about that idea, a benefits calculator, as a way of empowering people that we serve and empowering our workers, are the people that work directly, the direct service folks, in a way that didn't exist before. However, the idea has been talked about and tried. In fact, we had begun testing a template that wasn't live at all, and it didn't have any driven by anything in its background or in its back office, no software. But we had sort of this idea that people could use a certain screen and see about what they were qualified for. And then you called. So the timing was great, and it's something that we've learned now over the past several months that our members are very, very interested in and using.
Well, let me ask you a question about that because, like, you are very clearly the experts, one, in benefit navigation. Everything you just said is very aligned to our mission, and we didn't say it first. You definitely said it before us. No wrong door. Have it be dignified. Have it be easy. Have it all be in one place. You come for one thing, you can find all the other things you should be accessing. And you've been doing this forever, right? Like so much longer than we have. We're a very young new startup, and you very early on believed that like this was necessary, this was important, and that like what we were doing was different. And I'm just curious, like what made you also excited to work with a tech product and to kind of jump in this with us? Because it's been a great partnership and you were definitely one of the first.
We have a training center, and every year we have a leadership development group, folks who are middle managers and others who want to move up to management or to lead the agency. And they do a capstone project. I would say over the past 10 years, there have been 3 or 4 or more capstone projects about this subject. So it's
Wow.
been on the minds of our young leaders, and that's because it's been on the minds of their executive directors and their CEOs. We took their lead in some sense. Like if this is something that is percolating to you as managers from the direct service folks, who include family service workers and case managers and people who help people qualify for fuel assistance, any way you can think about an interface, then that sort of spoke to us as an important aspect of the work that our direct service folks do, but also how we can help the people that we serve. We're going to continue to learn more about why this is so important from a process point of view to the people that work in our agencies who do the intake. And there are a couple of different ways, and I can get into that in a second. There's another sort of historical piece, if you'll indulge me. And it's also going to be, we're also going to learn more about why this is so important to the people that we serve and so empowering. Part of the mission of what we do is embedded in the text of the statute, and it's called maximum feasible participation. And that means on the part of the people that we serve. I didn't get into how we're structured. And the reason what makes community action agency so special is that we are anchored in the community by a board of directors, which is divided up into 3 groups: the people that we serve, the business community, and the sort of elected and appointed official community. And then what we call public officials. The other aspect of our structure, which we think is really unique, is that every 3 years we must do a needs assessment and develop plans to address those needs. And every year, then their needs vary slightly, but lately, food has been a big need. Housing is top of the list, and fuel assistance. And those are now what's on sort of top of mind for people. The idea of maximum feasible participation is something that we take seriously, and it can have a lot of different dimensions. The board, our boards that have folks who we serve, but it's also our people in the community. We're partners with the people that we serve. We want to make sure that we work with people, we meet them where they are, and that's also a virtue of MyFriendBen, because we know that it can empower, and we're learning that now. It can empower the people that we serve too. They come to us with just a better sense of what they are eligible for. And if we are working with the same sort of platform, if you will. I spoke with a colleague a couple of days ago about this, and she explained to me, she said that they are looking, and this runs sort of, there's a spectrum of activities that our members are thinking about with MyFriendBen. This particular agency is thinking about it would be a big part of the work that they do with their resource center, which is their central intake center. Not every agency has a central intake point, but they happen to. That's part of the service integration model. And they want MyFriendBen to be integrated into the processes that they go through when they meet somebody, for the first time. Many people that we serve, we know. Many people that we serve are new. And so MyFriendBen can be helpful, I think, on both levels. I mentioned service integration, and that's something that we actually very intentionally, and we worked with our agencies to achieve it, having been endorsed by our state agency with some funding many years ago.
That's great. I wanna show you something really quickly. So our quick dashboard look of a few hundred people in Massachusetts, now that we've gone live, have used it. And you just said, in your needs assessment that the 1 and 2 things that are of highest needs, in your community are food and housing. And sure enough, those 2 things came up on our screeners too, that the things that people are asking for most as their major needs right now are food and housing. So just to show you, your community as well as anyone, and we're so lucky to have you as a partner. But, like, our data is showing the same thing, and I think you're exactly right. If we had a single entry for, data points, we could look at this across Massachusetts and really understand for everyone, not just MassCap, the needs across your community, and better serve those folks and better offer those things. So, that's great. I wanna pull up one more thing too, because I want to ask you a Massachusetts specific question. So, Urban Institute is a partner of ours that is doing a third party review of My Friend Then, basically taking some data through surveys and interviews of really understanding how people use My Friend Then. Do they follow up and apply for benefits? What do they learn from this? And they also created this thing called the State of the Safety Net. And I'll put a link in the chat in just a minute for anybody who wants to see it. But this is the state of the safety net that basically you can look at any benefit. So LIHEAP, SNAP, SSI, the ones that they have here, WIC, and see what the participation rate is, what the enrollment rate, eligibility rates, the number eligible. And the good news for Massachusetts is dark color is a good sign, right?
Okay. Yeah. Good. Good.
You can see that I have it set to participation rate for SSI, but if we go to WIC or anything else across the board, Massachusetts looks like pretty decent. Like the work that you have been doing in advocacy and in supporting folks on finding benefits has moved the needle in your state over the last decades that you've been doing this, and yet you still invest in things like My Friend Ben. Tell me a little bit about that decision.
We're proud to be in a state that has a very effective system of care, or systems of care, if you will, and sort of the infrastructure of caring. And we're proud to say that we're part of that infrastructure. There are networks across the state that we work with, and they all of us sort of constitute that system of care. And those are animated by and driven by the fact that there's access to a variety of different services. It might seem a little counterintuitive that we want to work on and work with you. Again, we're so lucky to be able to work with you on a benefits calculator when there's so many benefits available. But in some sense, it does make a lot of sense, because while there is a really healthy set of programs that are available, there are also some complexities. Uh, to put it mildly, in fact, there are complexities, not some. And I think it's also important to note that part of what drives us when it comes to this is the need for improved access I think addresses some structural challenges that we face in this state and in this country. And when I say that, there are structural challenges that are making it more challenging for the people that we serve to together with them to fight poverty. Low wages, that's one structural issue. Rising prices, that's another structural issue. A structural issue that has to do with the systems that and the way that programs have evolved is the cliff effect, which I'm very familiar with, to sort of the sudden cessation of benefits at a certain income level, which people are beginning to address. But the other structural issue is that there are complexities when it comes to applying for services. When you look at the different analyses that people have done on a sort of client journey or client path, that while there are areas where there are no roadblocks, there are other roadblocks or complexities that people need to deal with. And so My Friend Ben, I think, is one really important way that we can sort of very straightforwardly say we have some structural challenges. There are complexities. We have eligibility issues. We want to make sure that people are eligible for things and that we can streamline that. But we also want to make sure that given where we are now with the different eligibility levels and needs to determine eligibilities, my friend Ben is an amazing tool. The system evolves over time, and that's why the other thing that's so important about my friend Ben and what you bring to the table, which is a powerful set of engineers, if you will, who can absorb information, make adjustments. And I'll just give you one really quick example. The session we had last week, a couple of our members noted that it was important to make sure that we all were up to date on changing eligibilities. One program that we have, fuel assistance, most years the eligibility, the benefit level can change given adjustments in sometimes federal funding. And that can happen in the middle of the season. We want to be helpful with that. And the tenor and tone of that suggestion was all positive. Here's another way that we could suggest that my friend Ben could be adaptive. But we have confidence that that particular piece of input will be, implemented over time. And so we all know that the programs change, and to have the confidence that those changes will be taken into account is really important.
Thank you so much for saying that about us as a partner. Like I said at the very beginning of this, Joe, you're everything we could ask for in a partner, and that you give us feedback. You're on the ground. You know what needs to get changed, and so the fact that you trust our engineers to take your feedback and make changes is great. Someone so astutely pointed out in the chat that you and I keep using two different terms, screener and calculator. And so I think it might be a good moment for us to kind of pause, let Graciela show off my friend Ben really quickly, show what it means to have a benefits calculator. And Joe, I would love, like, when she's showing the results page, just really quickly for you to say, like, how is this different than what's already out there? Because like you mentioned, for a few years now, people have been kind of saying this is the solution. This is a solution, I guess. And how did we get there? Graciela, are you set to go?
Yep, I'm set to go. Hi, everyone. I'm Graciela Gonzalez. I lead partnerships here at My Friend Ben. I have the pleasure of working with Joe and with Laura, and I'm really excited to take you through the Massachusetts My Friend Ben screen. I believe you can all see my screen. We're here on myfriendben.org, and we're going to press start here. You can see the states that we currently are in, and then you can scroll down to the map. You can see where we're going. I'm going to go here to Massachusetts. I'm going to press click to start. You can see here that My Friend Ben is available in 18 different languages. I'm going to continue on. Here we have an important page about what you should know. It also includes our privacy policy. We have a deep commitment to data security and data privacy. You can read more about that here. What you should know is that you can go through My Friend Ben anonymously. I'm going to click here. We can confirm that we're 13 years of age or older. And then when you're going through it, whether you're doing it right now on your screen or later on, please take some time to read this information above regarding immigration status, which we don't track. However, you can filter your results based on that, and the estimates that we provide. Here at the top, you can see that there's 12 steps to this process. We're currently on number 3. I'm going to choose a zip code of Mission Hill in Boston. Press continue. We're thinking of a household of 2, a young mother. She was born in 2002. She has a little guy. He was born in 2023. And we're going to list his relationship to her as child. Continue on. Here, you can select information around health insurance. Obviously, this helps us determine your final results. And you have the choices here of I don't have, or I don't know if I have health insurance, employer provided health insurance, private health insurance, Mass Health, Medicare, VA health care benefits. This mother does not have health insurance. Here are some special circumstances that may apply to her. She may be a student in college, pregnant, blind, or visually impaired, have a disability that makes her unable to work, or a medical or developmental condition that's lasted more than 12 months. We're going to say that she's pregnant in this situation. Here she has the opportunity to list her income sources, as we know that this does affect eligibility. She can put employment income, government benefits, as well as the rest of these listed under here. We're going to put employment income, and we're going to put wages, salaries, and tips. She works hourly at about 40 hours a week, about $18 an hour. Here, we can put information about her young child. He also does not have health insurance. None of these special circumstances apply to him. He doesn't have a significant income source, so we're going to continue on. Here is a table where she can list out her expenses. She does pay rent. She pays about this much each month. Utilities are certainly something that she pays for. She pays about this much in heating, this much for a phone. She doesn't currently have any medical insurance premiums that she's paying, but she does pay for childcare. She works nights, and she needs some support in the mornings as she rests, and takes care of the household responsibilities. And that's about how much she pays a month. Press continue. Here we ask about her household savings and available cash. We see a wide range here. On the back end, we see about $8 average among all of our users and completed screeners. For this mother, we're going to put this. Here she can answer if she's already receiving some government assistance. This can help with her results page and also help her identify if she's automatically eligible for something else. You can see here cash assistance, food and nutrition, childcare, housing, utilities, other categories as well. In this case, this mother would prefer not to answer, so she's going to continue on. Okay. Here is where we identify how we can support her with some short-term assistance. Food and groceries is obviously something on her mind. Diapers, she's got a little one and another one on the way. Rent is always something that she would welcome help with. Maybe she has a concern about her young son's development. She has some questions. She hasn't been to the dentist in years. Perhaps some job resources she's curious about. There's some other categories here that you can see on the page. Free civil legal needs or identity document support, a challenge about herself or her child that she'd like to talk about, family planning, or resources for veterans. Those don't apply to her right now. She's going to press continue. Okay, here you can see we're at step 10 out of 12. We're going to scroll down and press test prospective partner, just so that none of the information that we put in here is actually used in our impact data on the back end. Here she can share her information to receive her personalized results to her email or cell phone. She also has the opportunity to receive more information when we add new programs. There's over 30 programs that that the Massachusetts screener pulls from as it determines her eligibility. We're not going to select those. She's going to go through this anonymously. I'm going to press continue.
I'm going to pause you really quickly right there because I think it's really important to note that no one is ever required to give us any information in order to get their results. We are the only screener at this point that does not charge, does not ask for your email, does not force for your phone number. 2/3, actually, 3/4 of people do choose to give us their information so they can get it emailed and sent to them, but never is it required. So as you can see, she went through, didn't click that, didn't put in any information, and it's still going to check the information is correct, give her a live link of results that also updates and that she can go back to, even without that saving information. Sorry, Graciela, keep going.
No, that's a great point. And that really came out of conversations and listening to families and communities and navigators who had identified that there was a lot of fear around providing their private information. And so when MyFriendBen was created, it was with the intention of that there shouldn't be any fear around finding your eligibility for public benefits. And that's a really important part of our design, as Laura described. We're going to press continue here, and we're going to start counting. 1, 2, 3, 4. And in 4, we see that she's eligible for 16 programs in the state of Massachusetts. with an estimated monthly savings of over 6,000. Here are her results. I think, it's astounding to me every time I do this screener what an incredible safety net Massachusetts have. But I think one of the complexities is just understanding what's available and having it all in one place. And that's one thing that my friend Ben really seeks to do is to provide a results page that combines long-term assistance with short-term assistance, um, all here together. Here we have.
Right, so let me pause right there, and this is a good time to bring in Joe. So if you could get just a little bigger, Graciela, that would be great.
Yep.
You can kind of scroll through it. But Joe, like what to you, based on the question that we got, makes this a calculator? And then two, what it makes this different from other initiatives you all have been a part of in the last 4 or 5 decades?
This is, again, this is an amazing tool. Um, and I would say the key difference is that it has access to so much information in real time and the promise of being able to update that information. What I found from talking to folks, and even one of our agencies who was contemplating putting together a system like this, is that they just didn't think they had the ability to keep things updated or even the coding ability. So that's right away what this strikes me as. Also, um, everybody who does anything like this strives for a really good graphical user interface, something that people can see and understand right away. And this I think does it. We've talked a little bit with you all about what is the best way to express the benefit that's coming to people, and on a monthly makes sense too. Sometimes it's more seasonal because some programs like fuel assistance are through a certain part of the year, and so it's hard to think about those benefits on a sort of a monthly basis across the year. But I think that it gives people, but I think as well, most people think about their monthly expenses, right? So that's why I think it's so important to have done it this way. Um, as you were showing this, Graciela, I've seen this a few times, and I learned something each time, and it makes me think about different things each time. With this, I was actually harking back, Laura, to a question that you asked related to. It caused me to think about structural challenges that we face, and I want to let you know too that one of the drivers for our interest in this is that conversations about access came up during a process that we were involved with, a poverty commission in Massachusetts that we were grateful to have been able to advocate for. And the Commission on Poverty did a lot of research, interviewed many people, and then came out and then developed a report, which has a series of really important recommendations related to legislation, related to line items in the budget, related to public policy, but also related to program and practice and access. I was on a subcommittee that focused on access. So there's a commitment, I think, on the part of people who run agencies across the state, policymakers, and others to really focus on and understand the power of access and why it's so important to continue to work on it. So that was one of the recommendations in the report of the Poverty Commission, is to do things that would enhance access.
Again, it
And
shows how vulnerable your community is. That another very high ranking right now need in Massachusetts is heating. So to your point about like utilities are seasonal, right? I don't know if it was recently a little colder in Boston, but it's interesting in the last few months that that's come up quite a bit for us. Graciela is scrolling through and she's going to click a little bit about, so you can see what happens for folks when they do click that, like learn more. We'll take you straight to the application. We'll tell you what forms you need, exactly how much time it should take you to apply. Obviously, that depends on like, can you find your ID? I never know if I can. But it's really good information. But one of the things, Joe, that I think you said that was really powerful to me is the user interface is so easy. I feel like this is super, you know, MyFriendBen was originally built with 100 families in mind. They were Colorado families who helped us build it, and the first thing they said over and over and over again was these websites, these government websites make me feel bad, or some of the places I go for help make me feel guilty for needing help. I'm curious, like, have you heard that? Have you heard that from families? And does it make sense now that you see My Friend Ben that that was kind of like the lens we took?
Yeah, I really appreciate you bringing it up because it goes to the idea of the stigma that the people that we work with in our agencies have had to deal with for many, many years. I just think that we're making inroads into um, helping people to understand, first of all, that we are helping each other. We're helping our friends and neighbors. And the economy is such and conditions are such that um, w- we all at one point in our lives have needed help. And so that first sort of recognizing that there is a stigma, but understanding that there are ways that we can humanize what we do. And this is one of those ways. It's straightforward. I do think because it is so straightforward and easy that sends a message that it's important to make it so that it's not a struggle. Uh, and, and that's part of our approach too. That people that work in our agencies, the people who work directly with people that we serve, are incredibly good at helping people navigate. And I think that's a phrase you used in this context too. And so this is another tool for the folks that in our agencies that help others navigate.
Amazing. Elizabeth, we got a couple questions. So Elizabeth asked, you said the link will update. Yeah. So if you save the URL, so if you go all the way through My Friend Ben, get to a results page, and and you never put in your email or anything, but you have the URL and keep coming back to it. If something changes, like we add a benefit or we change the eligibility rules, it also updates there. So Graciela, you're so perfect. She's pulling it up here where you can copy your link to your clipboard. You can also just save the URL. And if you come back like a month later and something has changed, it will change there as well, even if you haven't gone through the screener again. That said, I will also add that many people use the screener many, many times. They use it themselves and they take it home, let their family use it, or get a raise and they want to know if their benefits are going to change. They basically use it all the time, and it is always free, always open, and you can use it as many times as you want. So that's kind of our answer there. Elizabeth, I hope that covers it. Kind of give me a thumbs up if it does. If there's more to that question, let me know. And then someone else asked about, what if I'm like 19 years old, and it's so interesting that this conversation came up because we hear this a lot. We actually have some partners here in Colorado and in Illinois that are community colleges and higher ed institutions about young adults. So people who are kind of uplifting their life, they're in college, they feel like they're supposed to be on their way. And the reality is about 30% of college students do qualify for SNAP benefits. Very few of them actually access it, but could be qualifying for SNAP benefits and other benefits as well. And so the young adult population is one that we're very interested in making sure that they know exactly what Jody said. Everyone needs help sometime. This is for all of us. We are all helping each other. And so whether you are attending school or somewhere else doing workforce development or something, if this is a base that would help you and help you feel safer and more secure, that's what we're hoping for. Joe, would you add anything to that?
No, I thought you said it very well. This is a tool. And is harking back to the conversations we had on the Poverty Commission. There are so many ways that we can help people with policies and programs and budget items, but also taking advantage of what already exists and helping people to take advantage of that in a way that is really all about enhancing programs and enhancing practices.
Amazing. And Joe, one of the things that you said at the very beginning, you talked about like efforts for a common app and things that you have helped advocate for. When you think about, let's say, the next 2 years, the next 5 years, and the next 10 years in benefit access, what are you hopeful for?
I think we've talked about that a little bit, and what I'm hopeful for, I think this is, I hope, shared by the folks on the line, and then my colleagues, is a system that, and we talk about this. I'll just take a step back. We talk about this in terms of tax credits. There are these wonderful tax credits in Massachusetts. The earned income tax credit, a state version of that, a child and family tax credit, what we call the circuit breaker for retired folks. And those were just created a couple of years ago by the governor and legislature. We're grateful for those tax credits. People can realize $10,000 or more. And we urge this state to help us help people access those. It's almost like access is all when it comes to services. And so that's what I try to keep in mind when it comes to MyFriendBen, and that is down the road, a system where there is effective blending of technology and people. I think we all worry a little bit about depending, say, on technology a little more than we should, or not enough, and there's that balance. And the fact that the three of us are talking, and that this is driven in many regards by the people that serve folks. 7 of our agencies or 8 of our agencies were involved in your initial testing. That's the balance that I look forward to. That there's this smart, effective, safe use of this really impressive technology down the road, and that it becomes easier and easier for people not only to know if they're eligible, but to know what they're eligible for.
Okay, we didn't prepare for that question, but I don't think your answer could have been better, because for me, like, partners like you who are doing the on the ground work make it so that we can be the technology solution, and do the things that make it so, when one navigator or caseworker can only meet with, 10 people a day, the 10,000 that are still in line can somehow get help through technology, and we can learn from each other. So, I appreciate you bringing that up, and I appreciate the way you said it. Elizabeth, I'm not sure I totally understand your question. So if you'd elaborate a little bit about what you saw, what you'd like an answer on, that would be great. And then really quickly, to your point about, like, as technology, what else can we do? We've already learned so much about people get through My Friend Ben. They see everything they have access to, and then they often have to go try to find a person to help them. And so we're trying to bridge that gap for those who can't get help from a person or are working on this at night. They're working all day. 60% of our respondents have jobs and are employed. And 2/3 or 1/3 do this at night between 9 p.m. and 5 a.m. And so two things that we're working on, I'm just going to show you really quickly. I'm not even going to do videos. I'm just going to show you an image of it really quickly of kind of what's coming next because of the inspiration of um, the groups that we work with. So the first one is there will now be an assistant that will guide you through the results that come out. You can kind of see it right here, where it's at telling you which benefit to apply for and helping you figure out where is the best place to apply and get your materials. And if you have questions, if you're not sure what's coming next, the assistant will be there. We just had someone do some user testing, and they said the hardest part was actually they had to wait on a phone to, like, verify something, and the BenBot assistant kept saying, "You can do it, stick with it," which was really great. And then, obviously, our friends at MASSCAP and also at Cambridge Community have talked a lot about HR1 and the somewhat deliberate attempts to kind of make benefit access harder. And so, another thing that we're working on right now that's pretty early days is what we're calling the benefit manager. Let me see if I can find it really quickly. There we go. And you can kind of see a little bit of what this looks like. So this is like a different page, but it's showing you the benefits you have. You could be getting this. And then, as you go through, if you scroll all the way down, it'll show you where you can kind of, like, organize your benefits. Let me see if I can get an image of that really quickly. Um, and when you organize your benefits, if you have something that's up for renewal, like SNAP or Medicaid, that will help remind you and help you do that as well. So, those are kind of next steps that are coming mostly from these partnerships telling us the best ways we could be using technology. So, there's that. Awesome. Okay, Graciela just did a perfect job helping with Elizabeth, and she's also doing a perfect job kind of segueing to the end of this. And that here at My Friend Ben, we're always looking for partners. We're always looking for people to learn from. So you can email Graciela at graciela@myfriendben.com, or I'm Laura at myfriendben.com. But Joe, I've got to give you the last word. Tell me a little bit. When you think about the best part about this partnership or the best things that we've done so far, what would you say?
That like other productive partnerships. It's productive and straightforward, and sort of mutually beneficial. But the thing that I think it's marked by it's how open and eager you are to feedback, and to sort of, if you will, meeting us where we are, sort of on the ground here in Massachusetts, having brought with you expertise that you've gained over the course of a few other states. So that, I think that's, to me, the most important part of it, that our conversations have been straightforward, and you've sort of embraced our take on what would be helpful to our agencies and the people that we serve, and we're in sync. We I was so pleased to have been so pleased to see that you list our agencies in the results, if you will. And the reason that's so critical is, again, something that you've embraced, and that is that not only are we in partnership, but we at CAAs are in partnership with the people that we serve. And so this tool is something that we can work with together. And our hope is that if, folks come to us having had the information that they've gathered, and that just helps all along the way. So, I'm really looking forward to seeing what we learn together, not only from the people in our agencies, but also from the people that we serve. And we might, as we talked about earlier, we might learn things that we never expected. But that would be very interesting and important.
Well, here's to learning some things we never expected. Thank you so much for your time today, Joe. Thanks, Graciela, for the excellent demo. And thank you, everybody who showed up. I know a lot of people are going to watch the recording too. So thank you to you as well. Have a great rest of your day. We see you next time.
Thank you very much.